Hello, this is Dr. Grande. Today's question is, what is the course of bipolar disorder? When we talk about the course of a disorder, we talk about what tends to happen over the time that somebody has the symptoms of the disorder. If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. So when we talk about bipolar disorder, we're talking about a disorder characterized by the occurrence of manic episodes, so these periods of time when mood is elevated, and major depressive episodes, periods of time when mood is depressed or low mood. We consider bipolar disorder to be a chronic disorder. So usually after onset, somebody will have symptoms on and off for the rest of their life. In some cases, bipolar disorder remits. The disorder goes away. We don't know why, but most of the times I mentioned, we consider this to be chronic. Now, when we talk about the course of mental health disorders, with some mental health disorders, it's expected that a symptom of that disorder or several symptoms of that disorder would be present every day or most days in a week. Bipolar disorder is a little unusual in the sense that it does have these manic episodes and oftentimes depressive episodes, not always, but often. And they are markedly more severe than what we see the rest of the time. Usually between episodes, most individuals will have symptoms, but they're not as severe as what we see during the manic episodes and the major depressive episodes. Also making it more difficult to understand the course of this disorder is not every episode is clearly a manic episode or clearly a depressive episode. We also see hypomanic episodes, which are episodes of mania where the mania is not as pronounced, not as severe as what we see with a manic episode. And also there are mixed episodes, episodes where there are features of depression and mania at the same time, which oftentimes by itself seems confusing because it seems like those two sets of symptoms could not coexist. It's important to understand that there are two types of bipolar disorder. There's bipolar 1 and bipolar 2, and both are severe and chronic. The mean onset of bipolar 1 disorder, meaning the average age of onset, is 18, and for bipolar 2 disorder, it's somewhere in the mid-20s. We also know that the lifetime prevalence of bipolar disorder is around 4%. We know that if an individual has one manic episode, there's a 90% chance that they'll have at least one other manic episode during their lifetime. And we know the mean number of lifetime manic episodes is 9. Now we're talking about any type of episode, so manic episode, hypomanic, major depressive episode, or mixed. The median duration of an episode is 13 weeks. Now, in terms of when episodes occur in relation to one another, it's important to understand that any combination of episodes is possible. So somebody could have a hypomanic episode, there could be a period of time without many symptoms, then they could have another hypomanic episode. It doesn't always alternate, for example. But we do know that it's fairly common for a major depressive episode to occur immediately before or immediately after a manic episode. Episodes tend to become more frequent as an individual gets older, and as an individual gets older, we see more major depressive episodes as opposed to manic episodes. So a lot of times when people think of bipolar disorder, they think of the manic episodes and the depressive episodes as being somewhat balanced. But as an individual with this disorder ages, it's likely in many cases that they will see more major depressive episodes and fewer manic episodes. Now, in terms of bipolar 1 and bipolar 2 disorder, we think of hypomania as being associated with bipolar 2 disorder because that's one of the main differences between those two disorders. But actually, somebody with bipolar 1 disorder will likely experience more hypomania than somebody with bipolar 2 disorder. Again, this seems counterintuitive because hypomania is so critical to the definition of bipolar 2 disorder. We know that a number of manic episodes also start with a period of hypomania. So hypomania can lead into mania with bipolar 1 disorder. Symptoms of bipolar disorder are often present between episodes, although usually not as severe, of course. We call these residual symptoms. And with bipolar II disorder, we know that the periods between episodes tend to be shorter, and the major depressive episodes tend to be longer. There's also a greater probability with bipolar II disorder that rapid cycling will develop. And rapid cycling is when there's 4 or more episodes in 1 year. Rapid cycling is associated with less favorable treatment outcomes. So when we look at bipolar II disorder compared to bipolar I, oftentimes people think, well, it's a less severe version. But as you can see, it's really not. It's different, of course, than bipolar I disorder, but it's not less severe. With bipolar I or bipolar II disorder, we know that suicide risk is high, about 15 times greater than the general population for bipolar I disorder. And the research is mixed in terms of bipolar II disorder, but the latest research indicates that the suicide risk for bipolar II disorder is about the same as bipolar I disorder. We also know with bipolar I disorder, with mania, there's an increased risk of violence during that time, and suicide and self-harm is included in that violence. The research tells us that the greatest risk of suicide with bipolar disorder is when there is a major depressive episode or a mixed episode. And we believe a lot of that risk with the mixed episode comes from the combination of depressed mood and high energy and restlessness. So both bipolar I and bipolar II disorders are chronic in nature, both are severe disorders, both carry significant suicide risk, and both really necessitate mental health treatment. We know that bipolar disorder in general tends to respond fairly well to treatment, particularly if the treatment continues throughout the lifetime. I hope you found this description of the course of bipolar disorder to be interesting. Thanks for watching.